here. Start recording here. And whenever you're ready, go ahead.
Okay. Hello there. Thanks for tuning in to the Highmark Health Options Health Awareness Series. We're glad you're here. Today we're going to talk about the opioid crisis and how you can use Narcan to save a loved one from an opioid overdose. Opioid addiction and overdose is a widespread problem both in the United States and here in Delaware. The good news is that Narcan is a nasal spray used to save people during an opioid overdose. You can save a life by knowing the signs of overdose and when and how to use Narcan. Did you know you can get Narcan without a prescription at your local pharmacy? There is also a mail order option for Narcan. We will discuss both options later in the presentation. Here are the topics we will cover. What are opioids? What is the opioid epidemic? What does the opioid epidemic look like in Delaware? How can you help someone who has overdosed? Have a Narcan plan. We'll share some resources as well. Now let's get started. What are opioids? Opioids are drugs used to reduce the feeling and intensity of pain. They can be natural, synthetic or man-made, or partly synthetic. Opioids can be broken down into three categories: prescription opioids, fentanyl, and heroin. Let's talk about each of these categories. Prescription opioids are generally safe when taken for a short time and as directed by a doctor. They're used to treat moderate to severe pain. They're used to treat pain from surgery or injury, and they're used to treat pain in health conditions such as cancer. Prescription opioids provide pain relief and cause euphoria. Euphoria is a state of intense happiness and self-confidence. Prescription opioids can be addictive and misused. Common types of prescription opioids are codeine, hydrocodone, also known as Vicodin, methadone, morphine, and oxycodone. Opioids are used to treat cancer pain. Recently, there has been an increase in using opioids to treat chronic pain from back pain and arthritis. People use prescription opioids despite a lack of evidence about their long-term effectiveness, the potential side effects, and serious risks that they pose. Side effects of prescription opioids include constipation, increased sensitivity to pain, nausea, vomiting, and dry mouth, sleepiness and dizziness, confusion, depression, itching and sweating, tolerance, which means you might need to take more of the medication for the same pain relief, physical dependence, which means you have symptoms of withdrawal when the medication stops, and low levels of testosterone, which would include less energy, less strength, and a lower sex drive. The second class of opioid is fentanyl. Fentanyl is a man-made opioid used to treat severe pain, typically cancer pain. Fentanyl is 50 to 100 times more potent than morphine. It is misused in the United States, and it is prescribed in the form of skin patches or lozenges. Fentanyl gives a high like morphine. It is often mixed with heroin or cocaine to increase its euphoric effects. It is also sold illegally. Most recent cases of fentanyl-related harm, overdose, and death in the United States are linked to illegally made fentanyl. Users can't know which illegal drugs contain fentanyl and how much. This makes using illegal drugs very dangerous. let's talk about heroin. Heroin is an illegal, highly addictive opioid drug made from morphine. Morphine comes from the seed pod of certain poppy plants. People often use heroin along with other drugs or alcohol. Heroin can be injected into a vein or under the skin. It can be smoked or snorted. Mixing heroin with other drugs or alcohol is dangerous and increases the risk of an overdose. When people inject heroin into a vein, they are at risk of serious long-term infections such as hepatitis B, hepatitis C, HIV, and infections of the skin, bloodstream, and heart. Xylazine is meant to be used as a tranquilizer for animals. Now it is being mixed with street drugs like fentanyl or heroin. In the Philadelphia area, xylazine is known as tranq. Users smoke, snort, or inject tranq. In 2021, tranq was found in more than 90% of street drug samples in Philadelphia. Today, tranq is found across the United States. Tranq is linked to a growing number of overdose deaths. People often do not know that tranq has been added to the drug mixture they are using. There is no way to test for tranq in street drugs. When used for an opioid overdose, Narcan can help a person recover. If Narcan is not working, tranq might be present. Tranq is not an opioid like fentanyl or heroin. People who use tranq may develop severe wounds. They can appear at the injection site or anywhere on the body. The wounds spread very quickly and will not heal on their own. Medical help is needed right away. What is the opioid epidemic? Between 1999 and 2019, nearly 500,000 people in the United States died from an opioid overdose. These deaths were from prescription and non-prescription opioids. The first wave began in the 1990s. During this time, there was an increase of opioid prescriptions. A sharp rise in prescription opioid overdose deaths began in 1999. The second wave started in 2010 with an increase in heroin overdose deaths. In 2013, the third wave started with a rise in synthetic opioid overdose deaths. Most of these deaths involved fentanyl. What does the opioid epidemic look like in Delaware? Opioids are the drugs most misused in Delaware. State and local law enforcement agencies report annual increases in opioid use and overdose deaths, along with drug trafficking, fentanyl and heroin availability, seizures. A drug-related seizure is a common complication of drug overdose. A seizure is basically a burst of uncontrolled electrical activity between brain cells that causes temporary abnormalities in muscle tone or in movements. You may experience stiffness or twitching or limpness. Location is also a factor. Fentanyl and heroin in Delaware are mostly from Philadelphia and Baltimore. Wilmington is the largest local fentanyl and heroin supply base. The main transportation source for opioids are interstate highways like I-95 and major thoroughfares from Philadelphia, New York, and Baltimore. Due to its location, Delaware is a critical point for opioids moving via the East Coast along the I-95 corridor. Let's look at some statistics for opioid and drug overdoses in Delaware. In 2022, 537 Delaware residents died from drug overdoses. Fentanyl was identified in 457 of those overdose deaths. Cocaine was found in 234 of those deaths. The people dying from these drug overdoses are your friends, family, and neighbors. 72% are male, 28% are female. The number of older people who are overdosing is on the rise. 142 of the 537 people who overdosed were age 51 to 60. Now that we've learned a little bit about the opioid problem across the country and here in Delaware, let's learn about how you can help someone who has overdosed. Finding a friend, a family member, or a neighbor who has overdosed on opioids is scary, but you can help save their life by giving them Narcan, which is very easy to use. A person who has overdosed will be unusually sleepy or unable to wake up. The first thing you should do is try to wake them by firmly rubbing the middle of their chest and talking loudly. If you can't wake the person, use Narcan, also known as naloxone. It is a life-saving nasal spray that you can spray into one of the person's nostrils to reverse the effects of an opioid overdose within minutes. Narcan takes effect very quickly to restore normal breathing to a person whose breathing has slowed or stopped after an overdose. If the person doesn't wake up or begin breathing normally within 3 minutes, give a second dose of Narcan in the other nostril. Signs of an overdose can be both physical and behavioral. These are physical signs you can observe: abnormal pupil size or pupils that don't change size when exposed to light, ashen or blue skin, convulsions, which occur when the body shakes violently because of violent involuntary muscle contractions, drowsiness or unconsciousness, loud or odd snoring. More physical signs of overdose are nausea and vomiting, shallow or difficulty breathing, sweating or extremely dry, hot skin, tremors or muscle spasms, and a weak pulse. Sometimes the way a person acts can indicate an overdose. This could look like agitation, which is a state of being disturbed or emotionally excited or flustered, delusions or paranoid behavior, hallucinations, staggering or unsteady walk, violent or aggressive behavior. Have a Narcan plan. If you, a friend, or a family member use prescription or non-prescription opioids, have a plan in case of an overdose. Get Narcan, learn how to use Narcan, tell your family and friends where you keep the Narcan, and make sure they know how to use the Narcan. You can get Narcan without a prescription from your local pharmacy or via mail order. Each pack of Narcan comes with 2 nasal sprays because sometimes a second dose is needed. Before buying Narcan, you must be trained on how to use it. You can get Narcan training at your local pharmacy or by watching a video online. You can buy Narcan without a prescription at places like Acme and Safeway, CVS, Giant, Greenhill, Rite Aid, ShopRite, Walgreens, Walmart, and Sam's Club. These are the steps to take to get Narcan through a mail order program. Go to nextdistro.org/Delaware, watch the Narcan training video, take the test, fill out a request form, receive Narcan in the mail at no charge. Or you can download Delaware's free Opie Rescue DE app. And finally, we would like to leave you with some resources. There are resources specific to Delaware and resources about Narcan in general. Delaware-specific resources for substance use disorders are delawaregoespurple.org and helpisherede.com. Narcan-specific resources are getnaloxonenow.org and narcan.com. And that brings us to the end of this topic. If you would like to learn more about the Health Awareness Series and watch other episodes, visit hho.fyi/HAS. Thank you for joining us. We'll see you soon.